It's almost bedtime, which means that it's time for your injection. I took your Omnitrope cartridge from the fridge 30 minutes ago, so it's now ready for you to use.
Hi, my name is Kyle. I'm 11. I have a growth hormone disorder. This means that my body doesn't make enough growth hormone to help my bones grow and my muscles develop. To make up for this, every day I take my Omnitrope growth hormone injections. I'm going to show you how I prepare and inject Omnitrope using my own personal pen. Getting started. Always wash your hands first. To make sure that everything remains clean and sterile, never touch the pen needle or place the uncapped needle on any surface. And always keep your cartridges refrigerated. Remove your cartridge from the refrigerator 30 minutes prior to injection to allow it to reach room temperature. Place everything you need on a flat, clean surface. Remove the pen and cartridge from their cartons if you are preparing the injection for the first time. Remove the pen cap from the pen body. Unscrew the cartridge holder from the pen body until they are completely separated. Pointing down, insert the cartridge, metal cap first, into the cartridge holder. Lower the pen body into the cartridge holder so that the black rod presses against the cartridge plunger. Screw the cartridge holder onto the pen body until the cartridge holder won't turn anymore. One of the blue arrows must line up with the yellow mark on the pen 5 body. For pen 10, that mark is white. Don't make it too tight. Place the pen on a clean surface, making sure it does not touch anything. Holding the cartridge holder, push the pen needle unit onto the pen. Then screw the threaded hub of the pen needle onto the cartridge holder. Gently pull off the outer pen needle shield. Save this outer shield for use after your injection is finished. Do not remove the inner pen needle shield. Check that the cartridge holder is attached to the pen body with the blue arrow aligning with the yellow mark for pen 5 or white mark for pen 10. Priming the Omnitrope pen. You must prime the Omnitrope pen if using a new cartridge. If you have already used the cartridge, no priming is necessary. Hold the pen with the needle pointing upwards. Gently tap the cartridge holder with your finger to help air bubbles rise to the top of the cartridge. If you are using Omnitrope Pen 5, set the dose at 0.05 milligrams by turning the dose knob one click. If you are using Omnitrope Pen 10, set the dose at 0.1 milligrams by turning the dose knob one click. For the Pen 5, the arrow on the pen body should be lined up with the small line between the 0 and the 0.1. For Pen 10, the arrow should be lined up between 0 and 0.2. Remove the inner pen needle shield. With the pen needle pointing up, firmly turn the dose knob back to the 0 position. Hold for at least 5 seconds. At least 2 drops of medicine must flow out of the pen needle for the pen to be properly primed. If at least 2 drops do not flow out, set the dose again at 0.05 milligrams for the Pen 5 and 0.1 milligrams for the Pen 10, and repeat this step until at least 2 drops of medicine appear at the tip of the needle. When the medicine appears, the Omnitrope pen is properly primed for injection and ready for use. Now continue with dose dialing. Setting your dose. To set your dose, turn the dose knob clockwise until you see the number of milligrams for your dose in the middle of the dose window, lined up with the arrow. You will hear a click for each dose increment you dial, but you shouldn't rely on the clicks to measure the right dose. If you accidentally turn the dose knob past your dose, do not dial backwards. Instead, turn the dose knob clockwise. You will see a bent arrow in the dose dialing window. Continue to turn the dose knob in a clockwise direction until you hear a click, and the entire pen body is fully extended. Now you can press the injection button down all the way for setting the dial to 0 without releasing any medicine. The right dose can now be dialed. Be sure to check that the cartridge holder is still attached to the pen body, with the blue arrow lined up with the yellow mark for pen 5, or white mark for pen 10. If so, the correct dose can now be dialed.
Once the correct dose has been dialed, place the pen on a clean surface, making sure it does not touch anything.
Making your injection. Don't forget to change injection sites each time you take your medication. Before you make an injection, remember to clean your skin well with an alcohol swab. Wait for the area to dry. It's important to change injection sites. Make sure the new injection site is at least an inch away from the last place. Insert the needle into your skin as instructed by your healthcare professional. After inserting the pen needle, push the injection button in as far as it will go and press firmly. You will hear a clicking sound as your dose is being inserted. Continue to press firmly for at least 5 seconds before removing the needle from your skin. Stop pressing the injection button before you carefully remove the needle from the skin. If you can't push the injection button in as far as it goes, or it stops during the injection and the cartridge is empty, then the full dose of medicine has not been injected. The dose indicator window will show the amount of medicine still needed to complete the dose. Make a note of this number. Reset the dose knob to 0 by holding the pen and turning the dose knob until it's fully extended. Remove the pen needle from the pen and remove the empty cartridge by unscrewing the cartridge holder. You can now insert a new cartridge and pen needle. It's important to make sure that the pen needle unit is not attached to the pen when replacing the cartridge. Once the pen has been primed for injection, you can set the dose to the number that you noted when the injection stopped and inject. This completes your dose. Finishing up, carefully replace the outer needle shield. Hold the pen by the cartridge holder and carefully remove the needle from the pen by turning the needle in a clockwise direction. Recap the pen. Dispose of your needles as instructed by your local healthcare professional. Do not dispose of used pen needles in the garbage. Instead, put your used needles and cartridges in a sharps disposal container. This is a special container for used needles and syringes. Remember to store your pen and cartridge in the fridge between 36 and 46 degrees Fahrenheit for a maximum of 28 days for the cartridge after the first injection.
One final thing, Kyle. Don't forget you have to throw away the used pen needle in a special container, not the garbage. Great job, Kyle. Now you know all about your Omnitrope pen.
I sure do. Thanks, Mom. Well, I guess it's time for me to go to bed now. Good night.
Important safety information. Omnitrope should not be used in children and adults with any of the following medical conditions because serious side effects, including death, can occur. A critical illness caused by certain types of heart or stomach surgery, serious injury, or a sudden and severe breathing problem or respiratory failure. Prader-Willi syndrome, who are severely overweight or have a history of breathing problems including sleep apnea, cancer or other tumors, allergies to growth hormone or any of the ingredients in the medicine, certain types of eye problems caused by diabetes. Omnitrope should also not be used in children who have completed growth. Patients should tell their doctor about their medical and family history, treatment use, and past and existing medical conditions, such as but not limited to the following: cancer or any tumor, diabetes, use of prescription and non-prescription medicines, steroids, vitamins, and herbal supplements, pregnancy, nursing. The most common side effects of Omnitrope are local reactions at the injection site, such as pain, numbness, redness, and swelling, headaches, swelling associated with fluid retention, pain in joints and muscle pain, carpal tunnel syndrome, tingling and numbness, high blood sugar, hyperglycemia or diabetes, and sugar in your urine, glucosuria, unusual skin sensations, low levels of thyroid hormone or hypothyroidism. The other possible side effects of Omnitrope are return of tumor or cancerous growths, headaches, changes in vision, nausea, or vomiting. These may be symptoms of raised pressure in the brain, which requires immediate medical attention. Hip and knee pain or a limp in children, that can be a sign of slipped capital femoral epiphysis, worsening of pre-existing curvature of the spine in children, or scoliosis, increased ear infections and ear disorders in children with Turner syndrome. Check for cardiovascular disorders, hypertension, and stroke. Intense pain and tenderness in the abdomen as consequence of an inflammation of the pancreas, or pancreatitis. Gasping syndrome, decreased rate of breathing in children from high levels of benzyl alcohol, an inactive ingredient. Increased mortality in patients with Prader-Willi and acute illness. Please see full prescribing information for Omnitrope available at omnitrope.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. To report suspected adverse reactions, contact Sandoz Incorporated at 1-800-525-8747 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.